there's also a real betrayal that can be felt of your body. My body has let me down. My body is not doing the thing that it's supposed to do. My uterus's only job is to hold a baby. What gives, uterus? What have I done wrong here? There can be a lot of shame. There can be a lot of questioning about, like, what does this mean about me as a woman? What does this mean about me as a partner? And those are all things that can be worked out.
Welcome to Fempower Health. This is Georgie. Today we dive into a topic that is crucial yet often misunderstood. It's the connection between chronic pelvic pain and trauma. I've done many interviews on the Fempower Health podcast related to pelvic health and pelvic pain. And what I hear consistently is so many women continue to struggle. And a lot of times the condition that we may be treated for is just the tip of the iceberg. So what role does trauma have to play? So I'm joined by Rachel Zar, a certified sex therapist with a PhD in clinical sexology, who's passionate about helping people navigate the complexities of pelvic pain. And together we explore how trauma can manifest physically, why it's vital to address both the mind and body in treatment, and the empowering journey many take towards healing. So whether you are a patient or a clinician, this episode will shed light on what can be a deeply isolating experience and offer hope and insights. So let's get started. Rachel, thank you so much for joining me on Fempower Health today. This is such an important topic that I've been dying to talk about, and I'm so glad that you were referred to me, and I'm looking forward to our conversation.
Thanks for having me. I'm really excited to be here, and this is one of my favorite topics to dive into, so I'm excited.
First, I have to preface before you give your introduction and why this is such a passion. Probably a decade ago, the book Your Body Keeps the Score was recommended to me. And not that long ago, I actually checked it out of the library and I started to read it and then I put it down. I don't know why, but I did. I don't think I was triggered. I don't know. Maybe there was subconsciously I was triggered. I don't know. And then I got it again because I wanted to prepare for this episode. And I will just say that I didn't finish it in part because as I was going through it, it was very triggering. Just goes to show that this is a topic we must discuss. And so I acknowledge for those who tune in, some parts of this may be hard, but I assume this is going to be a fabulous conversation that I hope people come back to, because it's really about understanding this link of how trauma does impact our experience in this world, and some of the symptoms that we may have. And so welcome.
Thank you. And we'll talk about this, but so much of what happens with chronic pain, with pelvic pain specifically, is that it can feel so isolating. So I assume that one of the most impactful parts of this podcast will be just knowing that folks who are experiencing this too, you're not alone.
Yeah,
Right?
absolutely.
Sharing your story is so powerful.
Absolutely. So why don't you give us your background and a bit about why this is such a passionate topic for you?
Mhm. It was a winding road for me to get here. In terms of just my educational background, my master's is in marriage and family therapy, so I deal with relationships primarily. That includes relationships to ourselves. I'm an ASEX certified sex therapist, so I've done extensive training in sex therapy. I have a PhD in clinical sexology, and my dissertation was actually about the lived experience of chronic pelvic pain. So, this is a real passion topic for me. I primarily worked in private practice. I also spent 5 years at Northwestern Medicine Center for Sexual Medicine, where I worked alongside physicians and pelvic floor physical therapists to develop comprehensive treatments for folks who were experiencing all kinds of sexual functioning issues, but really the majority were folks who had some sort of painful sex, pelvic pain. It's where I really honed this expertise and this passion. But honestly, the curiosity about this topic goes way back. Before I was a therapist, I was a journalist, I was a magazine editor, and I was really mean, I have a gynecologist mother who specializes in sexual health, so I've always been probably more informed than most and really eager to spread the word about sexual health, about normal sexual functioning. And I was a freelance writer and was assigned a story about pelvic pain. And this was 15 years ago at this point. I was assigned a story about pelvic pain. I'd really never heard about it. And what I realized in researching that story was how little information. It was really hard to find information out there, to find names for these things, to find experts who really knew what they were talking about. And I wasn't holding all of the shame and stigma and physical pain that a lot of folks who are seeking this for themselves are looking for. So I wrote an article. I called it "Burning Love," and when I started in the world of sex therapy, my first ever client who walked through my door was a patient with chronic painful sex. And I was like, oh my goodness, I actually know about this stuff, right? I've written an article here.
Yep.
I didn't get a whole lot of it in grad school. I think we had one talk, which is more than most therapy students get. But it was just kind of this aha moment for me around like, whoa, I can actually help in a world where a lot of folks don't know about this. I do have chronic pain myself, so there's a personal connection for me there. It's been really helpful for me to understand the mind body connection around pain. And this just really felt like an opportunity to spread the word, to do some good. And it's kept me interested because of the folks, because of the clients I've met along the way. These are some of the most incredible people I've ever met. And the way I wouldn't wish pelvic pain on my worst enemy. And the way that folks are able to recognize my pain was telling me something. If it weren't for my pain, I wouldn't be this in touch with my sexual self. I wouldn't be this in touch with my partner. And really, really just transitioning it into this really powerful, empowered way of existing in their bodies and with the world. I have the best job ever.
Yeah, I mean, wow. So I will say I did get far enough into the book where I was just about to start on treatments, and I did glance through the book to look at the different treatments just so I have an idea of them. But what I found really interesting is a couple of points I want to bring up. So one is so much of our healthcare system is built on just giving people medications and not understanding mental health and how some
Mm,
of our mental health or our life experiences and traumas manifest in our bodies, like chest pain, pelvic pain, and all of these things. And Bezel and
sure.
his teams have worked so hard on trying to get the DSM criteria updated, and he writes a lot about the struggles with doing that, and you can see the impact of the treatment that we receive and how our lives are viewed because of these challenges. I know on social media there's a lot of discussion around only in the 1980s was hysteria removed as a diagnosis. What I would love to
Mhm.
understand is, one, pelvic pain is more than just endometriosis, but it is a topic I've covered a lot on the
Yes.
podcast. And so just giving that relation, I interviewed Dr. Peter Wright not long ago, and when I interviewed her, that podcast episode, like, blew every episode I've ever done out of the water, and the thing that she talked
Mhm.
about is how the like, endometriosis as an example of one of the conditions that pelvic pain can come from, the actual endo and is like the tip of the iceberg, and underneath it, there's
Yep.
1,000 different things, such as pelvic pain and trauma causing the pelvic pain. And so,
Mhm.
given these all these complexities, right, of how we misunderstand mental health, and we have to put everything in a bucket. Like, is it endo? Do you have depression? Do you have pain? Or do you have, hysteria? I feel like we try to put things in buckets, whereas it's really complex. And so,
Sure.
I don't know if we want to start with kind of dissecting chicken or egg. Like, is it like, how do you know how to differentiate, and do you really? Like, is it a cross-sectional team that you have to get together, right? So I'm trying to figure out, like,
Mhm.
how, and I don't know if we start with, let's talk about the link of trauma and pelvic pain, and maybe we can get into the how later. But I
Mhm.
just think just laying the foundation to say this isn't easy. It's not trauma or endo or
Mm-mm.
pain with sex or menopause symptoms caused by lowering hormones. Like it's complex.
It's the combination. Yes, and I think that I'm so glad you mentioned that because it's a place that a lot of folks get stuck when they're figuring out, like, where do I go for treatment? How do I attack this? People come to me a lot of times with, like, is this something in my body or is this something in my brain? And the truth is, in terms of the chicken and egg, it doesn't really matter because we need to get at both sides.
Okay.
And it's something that I'm always doing. And I think a lot of therapists will make the mistake of not addressing the medical side and just addressing the psychological side. And I think something that I always do with my clients right off the bat is I make sure that they have good medical care, because the pain that they're experiencing is real. Even if it started off as a psychological issue, our body adapts, and these are real physical things that are happening. You mentioned endo. If someone has, let's say, like a physical block in their vagina, or they have a vulvar skin condition, right? These things are real and they're traumatic to our experiences. And then often what happens is those pelvic floor muscles, it's a protective mechanism. It's a trauma response, will clench down to protect, regardless of where the origin is. If it's a psychological origin, if it's something that, like, I had this sexual experience that was really scary, even though my body was physically safe, those muscles may do the same thing. And with time, that is a real medical thing. Those muscles need to be worked out and relaxed. There are lots of treatments that can address that. But if we're just focused on, let's go back and reprocess this trauma and understand what's happening in terms of a trauma response, but we leave out the medical, those muscles are stuck in a tight position. So it's always really important to me, and it's why working at the Center for Sexual Medicine was so revolutionary to the way that I work, that I make sure that my clients, if there's any physical pain, have a stellar medical team working alongside me. And that means a physician who is trained and specialized. I know we'll talk more about finding good medical care in sexual medicine. That often means a good pelvic floor physical therapist. Pelvic floor physical therapists are like the rock stars of this world. They do more good than anyone else when it comes to treating
For
pelvic pain,
sure.
I think. But it really has to be a collaborative effort, whether it started off as something psychological or it started as something medical. If it did start off as something purely physical, like let's say that you have an imperforate hymen, you have a hymen that's blocking the entrance, it's excruciatingly painful. It's purely medical, it's a physical blockage. A lot of the folks don't have any history of trauma. If you live with that for several years without knowing what it is, if you're being dismissed by doctors, that's medical trauma, that's real. And living in pain for that long is traumatic to our nervous system. So it's still important in many, many cases, especially if it's been a while. If you treat it right off the bat, first experience, oh my goodness, doctor says, look at your hymen, it's imperforate, let's get that removed, done. You may not be left with any kind of trauma. You may not need therapy around it. Yay, good affirmative care. But so often, unfortunately, that's not the case. So it is important to recognize that not everybody with pelvic pain, with chronic pelvic pain, will have a history of trauma. And the experience of being in pain for long periods of time is traumatic. And not everyone with a history of trauma, even sexual trauma, will develop pelvic pain, right?
Right.
These things are highly correlated. They are not causational, right? There's
Okay.
no guarantee.
Well, and on the flip side, what I would say is,
Mhm,
for those who are seeing the medical professional that would be treating these things first, are they
mhm,
astute enough to recommend them to professionals like yourself? And so, like you were saying, if
mhm,
someone's coming to a professional like yourself, they should go treat the medical condition. And by the way, mental
mhm.
health is also a medical condition. So, by the way, the words I am using are not to dismiss or diminish anyone's role. I'm trying to just be clear in some fashion. But like, OBGYN, or the pelvic PT that they see may even want to recommend someone like yourself, right? So I think it's not just your profession linking to the others, but the other way around as well, right?
Absolutely. I get a lot of referrals from physicians, from pelvic floor physical therapists. This is part of the reason why it's really important for clinicians to be trauma informed so that they can see the signs in their clients of like, or in their patients rather, of, hey, you know what? I think a therapist might help you. And the ones who are really trained in this area do tend to understand that mind body connection and how important it can be.
Now, sometimes it's helpful for a real life example, so to speak. And I'm curious if there's, a case study or a mix of case studies to illustrate the point that you would like to share to kind of help bring to life some of these experiences.
Yeah, I definitely can. And as part of my dissertation, what I did was I collected stories from folks who volunteered to share their stories with us. These are not my clients, these are folks who volunteered to have their stories shared. Um, I can think of an example of a woman who had never been sexually assaulted, right? Really didn't consider herself a trauma survivor, but she grew up in a very violent household as a child. And she described, I learned at a very young age to keep myself very still and small. Right. So even as a tiny child, she's walking around with this kind of tension in her whole body. She remembers the experience of riding a bike as a little girl and feeling like, oh, this is really uncomfortable on my vulva. But of course, she's a child. She doesn't know what to do with it. And she actually ended up going to medical school. She became a doctor. She made it all the way through medical school and never, ever found out that there were treatments for this. Never, ever,
Wow.
ever. She got married, she was having sex with her partner, and it was excruciating. And she had a lot of adaptive experience in gritting her teeth through pain, right? She was trained for this. This was an adaptive response. Something's painful or scary, you tense up, you get through it, and then you get to the other side. So she was doing that during sex, and her partner was loving and didn't want her to be in pain. But she was, I'm fine, I'm fine, I'm fine, keep going, keep going, keep going.
Mm.
And she lived like this for 12 years, having this kind of
Ouch.
excruciating pain until she was pregnant and she started to have lower back pain. And remember, this is a medical doctor, right? She was pretty trained in this stuff, but she was
Yeah.
referred to a physical therapist for her back pain during pregnancy. And she just happened to off the cuff mention, and she knew the word for it too from medical. She said, oh, I also have vaginismus, which is the word for those kind of muscles around the vagina clamping down. And her
Right.
PT just said to her, well, this is not okay. We have to fix this. And she had never heard that before.
Wow.
In medical school, she remembers getting a lecture around, like, oh, 17% of women have painful sex. And that was it. No
Yep.
solutions. These are the words for it. So she started working with a physical therapist. She was referred to a sexual medicine doctor um, who gave her some amitriptyline cream that she was using on her vulvar pain. And by the time I talked to her, she was completely pain free. And it didn't take
Wow.
very long once she figured out what it was. But it's a good example of someone who would never have said, oh, I've been sexually assaulted and that's why. Mm-mm. But she was in a traumatic environment and her body adapted. And she'd been to gynecologists before, right? Gynecologists just kind of said, oh, have a glass of wine, or yep, sometimes people are in pain. Um, but it took a physical therapist to say, like, mm-mm, this isn't normal. And sometimes, especially as clinicians, that's the most powerful thing we can do. Even if we don't
Right.
know what to do about it, to just say, like, oh, this is not okay. So that's an example of the way that trauma can really manifest. And speaking of things that aren't in the DSM, we don't have what's called complex PTSD, which means it's not an acute trauma, it's PTSD from living in a traumatic environment. Folks will often experience this after having a childhood with a lot of adverse experiences, or after coming out of an abusive, whether emotionally abusive or sexually abusive relationship. Your body keeps the score, right? Your body adapts to living in that environment. It's very adaptive. It's brilliant, really. And then when you come out, it's hard to assess for safety, and your body can almost get stuck in that
Yeah,
adaptation or get triggered and come back to those adaptive coping mechanisms, which is why it becomes so important to create safe environments and then really retrain the body around existing in those safe environments.
absolutely. Yeah, one of the insights I've had is pain is not normal. And we get used to whatever our body is because we live with it every day. So we even normalize it, not just society. And just understanding the language, but because we're so used to it, we may not even know how to express it or talk about it.
Exactly, especially when it comes to women's pain. You mentioned period pain, pain during sex. How many of us were told that, oh, the first time you have intercourse, it's going to be very painful,
Oh, yeah.
right? I know I was told that. That's not true. It shouldn't be painful. There's no reason for even your first time to be painful. And we're not told that. And it's one of the reasons that folks don't bring their pain to their doctors. Also, a lot of doctors aren't asking, which is problematic. And a lot of doctors, I mean, think of the example of that woman I just mentioned, aren't told that this isn't normal. So they're reiterating that same thing to their patients. This is just part of being a woman. We see a lot of dismissal of women's pain, especially women of color, that are really dismissed, being hysterical, you're overreacting, and that is also very traumatic. It's gaslighting, right? It's telling folks
Oh, yeah.
over and over again that what your experience is fine. Don't worry about it. Just, have a glass of wine, try to relax. And folks will end up feeling like they're crazy, and then there's this deep level of shame. So it's why it's so important to know that any unwanted pain during a sexual experience, not normal. Nope, we don't want it. There are solutions, and you deserve care around that.
Yep, absolutely. How might someone experience pain? So we've talked about pain with sex, but there may be other ways. Like you mentioned back pain. A lot of pelvic PTs I interview, they're like, actually, lower back pain is a sign of, having issues with your pelvic floor. But
Yep.
there may be other ways. So can you maybe share with us and educate us on what what are some words that we could use to describe the pain? What are you hearing from your patients?
hmm Sure. So when we think about the pelvic floor muscles, and most folks haven't really seen what the pelvic floor muscles look like. And when we see these images of the uterus, it's very like spread out and pretty. That's not what it looks like in there. The pelvic floor muscles are this hammock of muscles that support our uterus, our reproductive organs, our bladder, our GI system. They surround our vagina. So, all of these things in there are very, very interrelated and are very correlated. So, if you have issues with your pelvic floor, whether that's vaginismus, which is like a spasm of the pelvic floor that can happen, whether it's a hypertonic pelvic floor, which is where your pelvic floor just kind of exists in a really tight place and can't relax, you're going to notice kind of a cramping, what you would expect. You may also notice deep pain with penetration, trying to stick anything inside your vagina, whether that's a toy or a finger or a penis. You may also notice GI issues, right? It may be hard to fully vacate your bowels. You may notice constipation or diarrhea. A lot of irritable bowel syndrome is right up in there. Bladder issues, bladder pain. A lot of folks who have persistent, or what they're told is kind of this recurring urinary tract infection feeling, it's actually a pelvic floor muscle issue. The other thing to keep in mind is that pelvic floor muscles aren't the only thing that impacts sexual pain. You may have a vulvar skin condition. So if your pain is external, and then it's not just going to be with sex, right? It'll be with riding a bike, with tight underwear. A lot of folks that have vulvar skin conditions, they're like, I can't wear pants, right? Like it can be really, really distressing. Sitting in a chair all day can be really hard. Standing for too long can be really hard. One of the most common forms of vulvodynia, which is what we call vulvar pain. So, your vulva, in case folks aren't familiar with this, because a lot of people aren't, the vulva is the external part of the female typical genitalia. So, that's everything that touches your underwear, everything that you can see or really see with a mirror when you're just looking at the female typical genitalia.
which many doctors suggest to look at so that you know
Yes,
if
know
there's
your
changes.
body, right? How funny is it that so many women will say, "Well, I couldn't pick my vulva out of a lineup," right? Because it's not as readily available. And then people will notice there's like a shame or discomfort with looking at this part of your body. We're like, this is just a body part. Get to know your vulva. It's also really, really helpful if you have pain to take a mirror and kind of poke around a little bit if you can tolerate it so that you have a sense of where that pain is actually originating. For a lot of folks, especially when we talk about folks who have pain because they're in a hypoestrogenic state, so that's like postmenopause, while you're breastfeeding, if you've been on a low dose birth control pill for a really long time, it's right around the vaginal opening where that pain will be. So this folks will describe it as like if you try to put anything inside the vagina, it's like a burning knife trying to get in there. That's a form of vulvodynia that is what it is actually the most common reason for painful sex. It's called provoked vestibulodynia, and there are treatments for all of these things. They exist out there. These are real conditions. And they are descriptors of where the pain is. There are all kinds of causes for this stuff, which is why it becomes really important to see a specialist.
So I don't know if we should dissect this a bit to kind of help people understand if you're this kind of a patient, how do you navigate?
One of the things that can be so distressing about endo diagnosis is that it is really hard to get an official diagnosis. And there's something really powerful about having a word for what you're experiencing. And when someone says to you, like, the only way to officially diagnose this is through surgery. Oh, well, I don't want the diagnosis that bad, right? Like, what else can we do? And it can be really confusing, especially for that mind body connection, in terms of like, well, I might have this thing, but I don't know if I have this thing. And all you have is a collection of symptoms. And a lot of these symptoms, as you've said, are things that people don't quite know how normal this is or how abnormal this is. I mean, you mentioned excruciatingly painful periods. Like, it is not normal to have to stay home from work because you have your period. It's not normal, right? And it's been so normalized, right? When you have your period, you become a completely dysfunctional person. It's become like a joke. Like, every woman has that. No, right? That's a sign of a problem. And that can be really confusing because folks start to internalize it as like, well, am I just a wimp? Right? Like, everyone else seems to be able to have their period and go to work, and I am rolled over in a ball with a heating pad. Like, what does that mean? Everyone else seems to love these certain sexual positions, but like, I can't tolerate it. Like, what's going on there? And it's where something like endo, that's so chronic, that of course comes in waves because it's associated with your cycle, can be really confusing psychologically.
Looking back and dissecting based on what you're saying, so maybe it's helpful. I can be a use case here. I had a 4-year journey with infertility, and my mother had passed away right when I had met my now ex-husband. And once we got married, we started to try right away. And I had a very proactive OBGYN. To this day, I'm like, was it a good thing or bad thing? Because I knew right away. She did some testing and she was like, you're going to have to go to a fertility doctor. And so I proceeded for 4 years to go to 10 doctors to be told I had unexplained infertility. Finding out the diagnosis, but realizing just how small of a group truly knows the complexity of it, seeing the mental health impacts, chicken or egg, is it, you know, for the mental health impacts, who knows if it was the endo or because who knows, trauma, I don't know. But nonetheless, like I get it. You're right. It's it's so hard to go through these things and it was so complex.
There can be a real sense of anger too, right? That feeling of, wait a minute, this was a thing the whole time. And if I'd just gotten to that clinician the first time around, how different would my life have been? And that anger is justified, right? It is not okay that so many clinicians, often through no fault of their own, right? This isn't being taught in medical school as much as it should
Correct.
be. They don't know, and they don't even know that they don't know. So they just say, this
Right.
is unknowable, right? And folks with all kinds of chronic pain in general, with all kinds of pelvic pain or painful sex, are being told this constantly. There's nothing that I can see that's wrong. So we don't know. Must be all in your head. It might be psychosomatic. That's actually how I get a lot of my clients. Is a doctor will have told them that it's all in their head and it's totally psychosomatic, which is almost never true. Right? It's there's something very real that's happening, and there's a real betrayal from the medical system. There's also a real betrayal that can be felt of your body. My body has me down. My body is not doing the thing that it's supposed to do. My uterus's only job is to hold a baby, right? Like, what gives, uterus? What have I done wrong here? There can be a lot of shame. There can be a lot of questioning about, like, what does this mean about me as a woman? What does this mean about me as a partner? And those are all things that can be worked out with a therapist, because of course we know that there's nothing about this that's indicative of your being a broken person or any less of a woman or any less of a partner, but it can really feel that way. There's a lot of shame, and a lot of betrayal trauma that can happen.
Honestly, it was this experience that inspired me to start Fempower Health, and I kinda tell people I equate it to, I want to find that 10th doctor for every topic in women's health and have women hear from them, and there was a woman who sent me an email, and she said, "I binged on your episodes, and now I have been able to put the pieces together on what's going on so that I know how to talk to my doctor." And notice she didn't
Mm-mm.
say I diagnosed myself. She just said, "Now I know what to tell them and what to ask." And that's really because it is hard. So, could trauma lead you to not know you have pain?
Interesting. Again, our brains and our bodies are so smart. It can be a really adaptive way that we cope with chronic pain or discomfort, which is to dissociate from it and treat it as normal so that it's not distressing, right? So, a lot of folks, I hear this actually all the time from clients. I didn't realize how much pain I was in until I was pain free. And the experience of being pain free
Ooh.
had them go, oh my goodness, I have been living in so much pain, because you adapt, right? So it's a brilliant adaptive mechanism. It's a really common form of adapting to either acute or long lasting trauma is to just kind of float out of your body a little bit. This is when we talk about the mind body connection. A lot of folks really adaptively have disconnected their mind from their body, and they can feel kind of like, oh, I'm not really noticing a lot of sensations in my body. And you can also have something of like an analgesic effect where just you're not feeling the pain. The thing that's important about that when it comes to, me as a sex therapist, is that if we're really accustomed to dissociating from our body, we can't just disconnect from pain. We have to kind of dissociate from all of the sensations in our body, which includes pleasure. So, a lot of folks, when they've been in chronic pain for a really long time, whether that's pelvic pain or another form of pain, they have a lot of trouble coming into their body enough to experience sexual pleasure, um, to experience orgasm, right? This can really stand in the way. So, a lot of the mindfulness techniques that therapists will use are around mindful awareness of pain, like the ability to lower the distress response when we notice pain. Because it's that distress response that has us totally like, nope, no, thank you. I don't want to be in my body right now. It hurts too much. Again, so smart, so adaptive. But it means that even a minimal amount of pain can trigger that. And then we're not in our bodies enough to experience any kind of pleasure.
Are there things that maybe we don't talk about enough that would be helpful for people to be aware of so that they can be like, "Oh, actually," and again, people who are suppressing, like, that's a whole other
Sure.
field that we can't, but yeah, I'd love for you to help us understand even what could be considered trauma as people are trying to navigate their health.
The things that we tend to associate with trauma are what we call like the big T trauma, like a really an acute experience of a sexual assault, a violent assault, um, being hit by a car, going to war, right? These really kind of like in your face, obviously it's trauma. The thing about that is that folks know that it's trauma, so it doesn't there's no such thing as easier when it comes to trauma, but in terms of like reconciling what's happening, sometimes it's simpler when it's something really loud and obvious and in
Okay.
your face. What we also know is that there are a whole myriad of little t traumas, and none of us go through life without little t traumas. And what's traumatic for me is not going to be traumatic for you. It's subjective. What trauma is about is the response that we have in our body way more than it's about the event itself. Big picture, when we think about trauma, it can be anything that is too much, too fast, too soon. So when we think about this in terms of sexual trauma, which we often do, experiencing something before you're ready to comprehend what's happening, too much, too fast. You weren't really ready for something, or your body wasn't really ready for something, and it happened anyway. Too soon, I wasn't expecting that yet, can really have a traumatic response develop in our bodies. Again, not always. Folks will have the exact same experience and it'll show up. We also think about these complex traumas, which are just being in a traumatic environment. And we have to acknowledge right now that, and a lot of other times in history, that like there are a lot of traumatic things happening in our environment. There are
Yep.
pretty horrific wars that are showing up on our screens every day. There's a really high stake election going on. There are school shootings, right, more often than we want.
Mhm.
And for some folks, it doesn't have the same impact on their nervous system. For others, it really, really does. And they are living with these complex trauma symptoms because of the bigger picture environment. We also see folks who are from oppressed communities, people of color, queer folks who will have a lot of trauma system because they're living in a system in which they have to have this kind of increased hypervigilance around their safety. So if we just ask folks like, do you have a history of trauma, which is often how clinicians are assessing for trauma, the vast majority of us are going to say no. Even folks who have been sexually assaulted or had a big tree trauma, they may say, oh, no, 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 other people have it so much worse, right? It's a coping mechanism
Wow.
to minimize, right? It helps
Yep.
us stay regulated to think that was no big deal. It's fine. It's fine.
Mhm.
It's fine. But when we really get into the weeds, it starts to make a lot of sense in terms of how much our bodies are holding.
All these tools that help us
Hmm.
have language around experiences to be able to differentiate what's normal or not, or even just to like help us reflect on our own experiences to be able to share with experts like
Mhm.
yourself when we're in therapy, to kind of help dissect some of
Yeah.
that.
No, absolutely, and it's why I'm a very insight-oriented therapist. I think knowledge is power, and the better that we can understand why our bodies and our brains are responding the way that we do, the more self-efficacy we have, the more empowered we can feel when we can start to make sense of things instead of judge or feel shame around a lot of these things. And we don't necessarily need to label it as trauma. Again, some folks love a label, some folks hate it, and that's fair. It's not about the diagnosis. It's about, oh, we can have a deeper understanding of what's actually happening in your body. And the more you understand it, the more you
Yep.
can make choices around it.
I think we've done such a great job. I mean, this has been so helpful because it's complex, right? And we can dissect this to, so many different ways, right? So as far as getting support, what would you advise is a good path forward? And any takeaways that people should consider?
I think for clinicians, especially folks who are touching their patients, especially who are touching their genitals, being trauma informed doesn't mean asking about trauma. It means assuming that everybody has trauma. So that means that you are always getting consent before you touch, that you are validating feelings, that if you notice that a patient is dissociated, is not present in the room, is tearful, is gritting their muscles, you stop so that you don't re traumatize. That becomes really, really important. And if you go into every appointment just assuming that this client has a trauma history or this patient has a trauma history, that is what it truly means to be trauma informed. It doesn't mean just asking, have you been assaulted? Because folks may not know, they may not be connected with that, and they may have many other kinds of trauma. So that's what trauma informed care really looks like. From the patient perspective, it is not okay for your clinician to keep pushing you if you're in pain, if you're not present in the room, if a medical doctor, if a therapist dismisses your pain, tells you that everything is normal when you know in your body it's not, tells you to just relax or have a glass of wine, or every woman experiences this, or I don't think it's as bad as you think it is. I mean, I've heard some truly horrendous things. You leave, you get a second opinion. And then you get a third opinion, and you get a fourth opinion. It is so profoundly unfair that folks have to do this much medical advocacy. There are specialists in this. When you have the language, you get to say, I have vaginismus. Do you specialize in that? Or do you know anybody that does? I love when therapists refer to sex therapy as an add on to their work. Even a lot of wonderful sex positive, affirming clinicians just don't have the specialized training in that. And folks like me are very willing to work collaboratively. We don't want to steal your clients. We just want to give them that extra support.
Absolutely. Wow. One of the things that I do is I have a find a doctor page, and there are all these wonderful lists out there so that people can find these subspecialists. And in some cases, they're not the most ideal list just because, we're working on being better about that. But I at least like to give people the resource so that they can do with it what they can. Pelvic PTs, obviously, I think I have a list there. But what about like trauma informed therapists or even sex therapists or any other subspecialties? Where can we find that? And then I'll put the link in the show notes for people to access. So, do those lists exist, and where are they?
The place that I generally direct folks for sex therapy is the American Association of Sex Educators, Counselors, and Therapists. That's AASECT.org. There's a list of clinicians on there who are certified. There's also a list of certified sexuality counselors who tend to be clinicians, whether that's physicians, physical therapists, a lot of PAs, or advanced practice nurses will be on that list. But if someone's listed on the ASICT website, you know that they have had extensive training and supervision and clinical work around sex therapy. I really like the Ishwish website for finding other clinicians. For therapists, if they don't say the word trauma in their bio, that's always kind of a little red flag that I would say, especially if you're working around sex and you're working about pain, having something in the description of your practice that says that you're trauma informed, trauma trained. This is really important. And it is okay to ask any doctor that you're seeing, any physical therapists, are you trauma informed? How would you describe being trauma informed? Get a sense of what that actually means, because everybody wants to be trauma informed, right? We all love to say, like, yes, of course, I always ask for consent. And then what happens is they say, hey, let me know if anything feels bad, right? And then that counts as consent. Mm-mm. I'm about to do this specific thing. I'm informing you of what's about to happen. Is that okay? Wait for an answer, right? That's trauma informed. So, again, it's okay to be choosy. I'm going to throw out another resource, tightlipped.org, for folks with pelvic pain. They're a medical advocacy group. So if you want to get involved, if you want to take that anger that you're feeling and put it towards a cause, they do wonderful work around speaking to clinicians. They also have support groups and support networks, especially if you're in New York or LA. They do events. They also do virtual events. They have a zine. These conditions can be so isolating, and isolation is a lot of what leads to shame, but they are so prevalent.
And how do you want people to stay in touch with you? And I'll put everything in the show notes too, so people don't have to memorize, but at least you can just verbalize it in case people don't want to get to the show notes.
Sure. You can find me on my website, rachelzartherapy.com. I see clients in Chicago. I also supervise clinicians and I provide consults for other clinicians, specifically around pelvic pain. If folks are interested in that, I also do teaching and education. You can find all that information on rachelzartherapy.com. You can follow me on Instagram, Rachel Zar Therapy. We're trying to raise those social media numbers. The practice that I practice at is called Avid Intimacy in Chicago, AVID Intimacy. That's where you can find me.
Awesome. Well, this conversation blew me away. So thank you for the work that you do. And I'm really honored that you made this time. This was a valuable discussion. I know it's going to help so many people. So thank you. Thank you.
Well, thank you for having me. I'm so happy to be here and to spread the word.
And that wraps up another empowering session here at the Fempower Health podcast. Now, before you dash off, I've got a quick, exciting invitation for you. Please join our vibrant community by subscribing to our weekly newsletter, because it's really your frontline update on groundbreaking women's health research, the latest health-enhancing products, fun quizzes to boost your health IQ, and unique discoveries that you won't want to miss. All of this delivered straight to your inbox, cutting through the noise of social media algorithms. Love today's insights? Show your support by rating and reviewing our podcast. Your feedback is more than just a pat on our backs here at Fempower Health. It lights the way for others seeking guidance and community in their health journey, amplifying the voices that need to be heard. And for a deeper dive into today's topics, check out the show notes and explore our website at fempower-health.com. Our site is a treasure trove of knowledge, neatly categorized by topics of interest and life stages, ensuring you find exactly what you need to empower your health journey. And your voice matters to us deeply. Whether you have a question, a story to share, or feedback on our episodes, reach out directly at info@fempower-health.com. Drop us a message on social media or hit reply on any newsletter. Your insights inspire our conversations. And a quick note, the knowledge we share is here to embolden you in discussions with your healthcare provider. It's not medical advice. Always consult with your doctor for health decisions. And remember, the diverse perspectives of our guests reflect their individual journeys, and it's not an endorsement by Fempower Health. Here's to empowering your health journey one episode at a time, and I'll see you on the next Fempower Health podcast episode.